everyone. I hope y'all are doing great this evening. My name is Madison Landrum, and I want to talk to y'all on why keeping up with your oral hygiene is so important. Within this speech, I hope to inform y'all on oral hygiene and leave y'all encouraged to be seen by your dental office on a regular basis. I know there are several reasons that deter us all from routine visits at the dentist. These can be anything such as dental anxiety, embarrassment, financial concerns, inconvenience, needles, or bad experiences. All of these are very understandable, but there are ways we can work past this. Although financial concerns and dental anxiety often deter individuals from visiting the dentist, maintaining regular oral hygiene is crucial for preserving overall health and well-being. Preventing the spread of cavities and infection, understanding how poor oral hygiene can affect one's everyday life, and the benefits of learning good oral hygiene habits at young age. Please go to the next slide. How to be happy and healthy. Maintain excellent dental hygiene, regular visits with the dentist, and learning good dental habits at a young age. Did you know that 3.7 billion people on this earth are affected by oral diseases and sometimes even death when not caught early on? It is so important to listen throughout the speech so that none of you end up in the life-altering outcomes due to neglect of oral hygiene. With working in the dental field and promising research, I have a good knowledge on the importance of maintaining good oral hygiene and being seen regularly at a dentist office. Today, I want to discuss the significance of practicing excellent dental hygiene and getting frequent cleanings to stop the spread of infections, and how bad oral hygiene can impact daily living, and the advantages of developing good oral hygiene habits early in life. Please go to my next slide. As you can see, dental health and overall health really go together. If your mouth is not in good shape, this can affect heart disease, tooth loss, bad breath, diabetes, and bad complications in pregnancy, mouth cancer, tooth decay, lung issues, issues with your brain, and gum disease. Making the connection between oral health and the overall well-being of an individual is crucial. Poor oral hygiene can lead to systemic health problems. Specifically within the mouth, bad oral hygiene can cause cavities and gum disease. Venturing past the mouth, bad oral hygiene can lead to heart disease, diabetes, respiratory infections, and in some very severe cases, Alzheimer's. We know now what bad oral hygiene can cause, but did you know that certain health conditions can lead to bad oral hygiene? While these individuals cannot help it, it's important to stay on top of your oral hygiene even more because of what it can cause. Individuals experiencing diabetes, heart disease, kidney disease, and rheumatoid arthritis can cause a negative impact on gums and teeth. Autoimmune disorders often lead to dry mouth, causing decay. Bacteria found in the mouth can find ways to travel into the bloodstream. This can lead to infections in the endocarditis. When the mouth becomes inflamed from infection, this can lead to inflammation in the body as well. In many forms of major diseases, chronic inflammation becomes at risk. When oral hygiene is maintained, these conditions decrease. Please go to my next slide. In this slide, you can see the makeup of the tooth and its surroundings. You have the enamel, the dentin, the gums, and the root, and the pulp. You can see here when you start getting a cavity, it gets right close to that pulp, which leads down to your veins and everything, and it can cause a spread. Upon my research, I found a real-life scenario of what years of neglect to your mouth can look like. According to case studies, real-life consequences of neglecting oral hygiene, we are giving an example of a man who neglected his oral hygiene and ended up with major health concerns. In this case, the patient was not aware of the amount of cavities he had in his mouth because to him they looked fine on the outside, and he did not want to go see the dentist. It is real easy to just look in your mouth and assume that all is good because you don't have the x-rays showing what's all going underneath. We are told that due to the years of neglect, this patient ended up with several health concerns, including type 2 diabetes and heart disease. Please go to my next slide. The benefits of regular checkups are catching decay at an early stage, reversible gum disease, screening for oral cancer, and costs in preventative procedures versus restorative procedures are a pretty big difference. We can now discuss the significance of maintaining these regular checkups and taking care of your teeth at home now that we have a basic understanding of the links between oral and general health. Keeping up with regular dental checkups can enhance the prevention of further dental problems. When x-rays are taken at a regular cleaning and checkup, the dentist is able to detect issues before they become non-restorable. This would result in extraction and enable to replace that tooth. You'll either have to have a removable appliance or go into the implant procedure, which is oral surgery. When caught early, cavities can be debrided and filled before the cavities reaches the nerve, as in the pictures I was showing y'all earlier. Gum disease can be reversed when practicing good oral hygiene and being seen by dental professionals every 6 months. At each checkup, all patients are screened for oral cancer. While brushing twice a day and flossing is essential, professional cleanings get the portion we can. These cleanings are performed to remove plaque buildup and tartar. Preventative procedures are much cheaper than those that require restorable treatment. Cleanings and checkup appointments vary between $75 to $300 before any insurance is applied. However, bigger treatment, such as implants, bridges, root canals, and crowns, get into fees anywhere from $2,000 to $7,000 before insurance coverage. And these aren't as fun as just coming in regularly for your cleaning. These involve going to specialists who can perform that treatment for you. Alongside the dentist, the dental hygienists provide knowledge and encouragement in proper oral care. Educating patients on the right toothbrush and techniques, flossing, mouthwash, and water picks play a major role in proper techniques and proper hygiene. Regular encouragement every 6 months also plays a crucial role in better home care. At those appointments, you're able to see what you're missing and learn some things you maybe didn't know. Now that I have stressed these important roles, let's talk about what is at stake if not taken seriously. Knowing the negative outcomes of bad oral hygiene can affect our mental and social well-being. Bad breath and stained teeth can cause embarrassment and judgment from others. So many individuals do not like smiling or talking due to missing teeth or dark spots from decay. The immense amount of pain our mouths can be in from infection and decay can lead to further stress and depression. Unfortunately, when our mouth is not presentable, it is more difficult getting hired for jobs and speaking confidently. Please go to my next slide. Understanding the importance of maintaining good oral hygiene habits at a young age is key success. Please go to the next slide. In my research, according to Stanford Medicine of Children's Health, we are quoted, experts recommend taking him or her within 6 months of the first tooth coming in, also known as erupting, or about 12 months at the latest. Habits developed in children at a young age follow them into their adult years. Educating young patients on decreasing cavities, seeing the dentist at a young age helps patients not fear the dentist as they get older. They're able to learn different foods to stay away from and different drinks with acidity to stay away from as well. Basic education on home care of your teeth is brushing twice a day for 2 minutes and flossing once a day as well. And I know that is not a popular thing to do, but it really gets in between your teeth, helping clean out the food you have in there and preventing that decay between your teeth, because it's a really difficult spot to get to. That's why brushing doesn't get it out alone. To properly brush, you want to hold your toothbrush at a 45-degree angle to your gums. This allows it to clean your gums and your teeth at the same time. Brush gently with a soft bristled toothbrush. on the outer surface of your top and bottom teeth, then you can go to the inner surface. And once both outer and inner surfaces are clean, then you can brush the tops of your teeth and your tongue. To close, worrying about your oral health does not have to be stressful when seeing the dentist on a regular basis and maintaining good oral hygiene at home. While the main focus of oral hygiene pertains to the mouth, it is also a critical part of individuals' overall health, appearance, and confidence. Routine dental visits every 4 to 6 months, combined with brushing twice a day and flossing, can prevent disease, reduce financial burdens, and improve life quality. I highly encourage each and every one of you to take your oral health seriously, and your overall confidence will really appreciate you for doing so. Thank you. I hope y'all have enjoyed this speech.